Hello, this is Dr. Gay from First Lake MRI, and this is a 42-year-old male who fell a little over a month ago on the hand and now is having trouble extending the fingers. And they did an x-ray when they got injured, and the doctor's office thought the hand looked pretty good, no obvious findings. And so they sent the patient home. The patient still continued to have pain and difficulty moving the finger, so they did an MRI. And on the MRI scan, we see that there is a problem over here. There's brightness in the fifth metacarpal bone right at the base. It's really bright here. So we know that there's definitely a problem. If we look over here, there's a little bright triangle. This is a fracture fragment that is normal in position, and this fifth metacarpal base should be over here. So this is dislocated, fractured. A little fragment got left behind, and this is dislocated towards the ulna. Here's the ulna over here. So dislocated towards the ulna and migrated proximally and hits this triquetral bone. Normally this should be up here articulating with this hamate bone. Instead it's articulating with the wrong bone. So on x-ray it just wasn't very obvious, but here you can see it's very obvious because your eyes are drawn to the bright marrow edema. You can see this little fracture fragment. So fracture dislocation of the fifth metacarpal bone that would explain why they're still having some pain. But there's also one other finding here. The x-rays look normal, but here we do see an area that is abnormal. We call this metallic susceptibility artifact. The MRI machine uses a magnetic field to create the images. Anything that distorts the magnetic field, basically a piece of metal, will cause a local distortion of the magnetic field, and you get an artifact like here. We call this magnetic susceptibility artifact. We know there's some metallic, or sometimes you can have air that can do it as well, some abnormality here that is distorting the magnetic field. Now on the x-ray, since there was no obvious metal here, this may just be a piece of wood or something that has a high amount of gas or air within it, and the oxygen may cause a susceptibility artifact as well. So that is one of the findings. If we look on an axial image through this region, this is the palm. Here's a dorsal hand. Here's the thumb over here. Second, third, fourth, fifth fingers. These are the flexor tendons. You have paired flexor tendons of the second digit, paired of the third digit. Here's the fourth digit here. And between these third and fourth ones, we see this fluid collection. And if we go up one more view, we see the little dark thing here. So this is a foreign body. So when they fell, they must have introduced a foreign body into there between these tendons. Luckily, the tendons are intact, but there's a little bit of fluid around it, and it's causing this prominent susceptibility artifact. So they're going to have to go in there and remove that. And this is something that they weren't aware of, interestingly. So a couple findings: a foreign body within the flexor compartment here between these tendons with susceptibility artifact, and also a fracture of the fifth metacarpal base with a dislocation. Again, you can see on this view a little fracture fragment back in the normal position here. And this is the fifth metacarpal bone that's displaced outwards, down, articulating here, and there's that defect. And that's a donor site for this fracture fragment that's left in place. And here's that foreign body that distorts the local magnetic field right there. And that's it. Thank you very much.